Millions of infants and toddlers get surgery every year, and there is mounting concern about the risks of general anesthesia in patients so young. More hospitals are now turning to an alternative, spinal anesthesia, which leaves babies immobilized, pain-free, and awake. Joining us now to discuss is WSJ Assistant Managing Editor Laura Landro and Dr. Robert Williams, a pediatric anesthesiologist at the University of Vermont Children's Hospital. Welcome to both of you. Laura, I'm going to start with you. What are the studies that we now have that show there might be dangers to children using a general anesthesia or infants?
Well, they're mostly, actually, they're all have been in animals. So animal studies, lab rats, monkeys, showing that the developing brain is affected in terms of memory, learning skills, cognitive function. So that rising amount of research has led to a bunch of studies in human children. But
we don't yet have any results from those studies, or is it too early to tell?
Actually, interestingly enough, there was a new interim result of the biggest study called the GAS study, which is looking at children comparing general and spinal anesthesia. And the interim results showed that at 2 years old, there was no difference in cognitive function, but the researchers said the endpoint of the study is 5 years, and at 2, you might not know these things. So we need to wait 5 years.
Right, certainly concerning. And Dr. Williams, at your hospital, the first choice for surgeries in the mid-abdomen and below is now spinal anesthesia. Is that correct?
Yes, it is. It's important to remember that by every available measurement that we currently have, general anesthesia, even in little babies, looks to be very safe. I mean, it's truly one of the miracles of modern medicine that we can take the small baby, put them asleep, and as far as we can tell, things look pretty good. I have very sophisticated monitors these days where I can watch every heartbeat, every breath of oxygen that goes in and out of the child is highly monitored. I can look at the amount of carbon dioxide, the amount of anesthesia gas when we have a child under general anesthesia. But when we have the option to do a child under spinal anesthesia, that's very different. In that case, I have the ability to actually hold hands with the baby while that baby is asleep and look the baby in the eye. And while that baby's holding hands with me, I can tell that they're comfortable, they're not in distress, and they're alert. And for me, that's a tremendous peace of mind while we wait to sort out any potential concerns with general anesthesia.
That does sound like an incredible peace of mind, not just for you, but for the parents. I guess my question is there ever a danger that the child or the infant might move too much during the surgery?
Well, we do have the ability, if we would need to we start an IV typically after the spinal is in so it doesn't bother the baby. So if we need to give some sedation medicine, that we can do that. And typically what we do is we choose surgeries that last about an hour and a half or less, because after an hour and a half, a spinal would wear off and the child would move. So we've been developing experience with doing different types of surgery under spinal anesthesia, particularly hernia repair. And we're very comfortable that we can provide a long duration of anesthesia and operating conditions that work for the surgeon. It is important for the surgeon to understand that it's a little bit different than when the child goes to sleep with general anesthesia. So we're blessed to have surgeons here at the University of Vermont who are used to working with us. They're highly invested in doing this technique.
It sounds fantastic, but Laura, there are certain surgeries for which spinal anesthesia is still not practical. Is that correct?
Well, obviously, you're not going to do brain surgery when the child's awake. There's a lot of neurosurgeries or things like that. Anything that would be like a heart surgery, things like that cannot be done with a spinal anesthesia, obviously.
Right.
And, the issue, again, as he mentions, it's considered safe while they're doing it. But the question has been raised and that they're trying to answer is, what about those longer term issues with the brain?
Yes.
And that's what the 5-year study is aiming for.
Right. And so, Dr. Williams, what is the recovery like after spinal anesthesia? Is it different than after general anesthesia?
Yeah, it's really great, actually. It's one of the things I really like as an anesthesiologist. After I've had a patient sleep with general anesthesia, at the end of the case, I need to take breathing tube out, let the anesthesia effects wear off enough the patient can breathe on their own, and then take them over to the recovery room where we closely watch them. It's very different in a case where the child's been awake, holding hands with me, not even needing oxygen. In that case, when we go to the recovery room, we typically hand the patient right to the mother. This is one of the places where our parents really kind of like this because they can hold the baby right away. They've obviously been anxious while they've been away for an hour or so from the child. They can nurse right away. And it's not only we like it clinically because it's a very stable thing to do, but it's very gratifying to hand the baby right to the mother.
Absolutely. As a parent myself, I can completely relate. Laura, what are the chances that this will spread to more pediatric hospitals?
Well, you have so many hospitals around the world, U.S., Europe, Canada, Australia, New Zealand, participating in these studies now. So there's a ton of research going on, and the hospitals are doing the research. So I think as you see the research come to the end, you'll see people get more comfortable with this and decide maybe this is an alternative. As one of the doctors said to me, if we didn't offer this and something down the road showed that there was a problem, we'd feel pretty terrible.
Absolutely. Laura Landro and Dr. Robert Williams, thanks to both of you for being with us today.
Thank you.